Mental illness knows no boundaries. It affects people of all ages, genders, and background.
Anxiety disorders affect many worldwide, manifesting in excessive worry, panic attacks, and social problems. Treating anxiety disorder, like many mental disorders, may involve psychotherapy, medication, or a combination of the two. If each psychotherapy, cognitive behavior therapy has been effective, it teaches the patient to think and behave in different ways and react differently to situations that will usually cause anxiety and worry. Medication like benzodiazepines or antidepressants might be prescribed as well. Benzodiazepines are a type of psychoactive drug that have relaxing and calming effect. Antidepressants might also be prescribed, like selective serotonin reuptake inhibitors or SSRIs, which regulate the serotonin levels in the brain and help the elevate mood.
Depression is more than sadness. It's a pervasive feeling of hopelessness that impacts daily life. The Anxiety and Depression Association of America, setting small achievable goals and celebrating even your little wins can help with depression. How can you implement this into your everyday life? Imagine that you have a school assignment or work project to finish. Doing the whole thing all at once might seem too daunting. Instead of just setting one big goal of completing this project, set little goals along the way. Step 1 might be writing the intro. Step 2 could be doing the background research, and so on. Successfully finishing each of these steps will help you build momentum and feel more confident that you can achieve your larger goal of finishing the project. This is one example of how you can build a sense of mastery. You have probably heard that exercise is an effective way to cope with depression, but did you know that part of the reason why it works is because it helps you build sense of mastery? Dr. Ellen Valentine, chair of the Department of Psychiatry at the University of Texas, recommends exercise to his depressed patient because it helps with depression by providing a sense of achievement, whether it's finishing a project, building a workout routine, or pick up a new hobby. Focusing on mastering small skills can help you cope with depression. Reduce rumination, according to an article published in Frontiers. In human neuroscience, people with depression tend to ruminate a lot on negative experience, which can worsen their symptoms.
Bipolar disorders. Bipolar disorders involves extreme mood swings from euphoric high to deep lows. Meet individuals managing bipolar disorder through mood stabilization techniques, medication adherence, and ongoing therapy. One of the older treatment is also one of the most effective treatments, and that's lithium salts. Lithium as a mood stabilizer smooths out the high and lows they experience. They say it is much better at treating manic rather than depressive episodes. And so individuals who take it often have to take other medications as well, which can be problematic since some antidepressants can trigger many episodes in individuals who predisposed to them. Other treatment options include antipsychotics, anticonvulsants, and benzodiazepines. but many of these, including lithium, that side effect that can be severe, and non adherence, which can be dangerous for an individual. Now, unlike certain disorders like unibipolar depression, psychological interventions like talk therapy or cognitive behavioral therapy are not particularly effective in treating the many episodes of bipolar disorder. Having said that, they can still be very helpful tools to help individuals with bipolar disorder in general.
Mental illness is diverse, but so are the paths to recover and resilience. By understanding, supporting, and advocating for mental health awareness, we can create a more inclusive and supportive society for all.
Thank you for joining us on this journey through the spectrum of mental illness. Together, let's continue to break stigma and prioritize mental health for everyone.